Thursday afternoon, high blood pressure, that's what we're talking about today. It's often called the silent killer, but thankfully there's various medications available to help manage it. Dr. Timothy Quinn joins us right now to talk about the symptoms and the risks associated with high blood pressure. Dr. Quinn, thanks for joining us. So tell us right now, what are those symptoms to watch out for?
Well, you noted the silent killer. In a lot of cases, there are no symptoms for a great deal of people, but some people can have symptoms such as headache, fatigue, maybe a little chest pain with palpitations, the heart beating fast. But for a lot of people, there are no symptoms, and that's why it's called the silent killer. And that's why this segment is so important.
So what are the different kinds of medications that people can take to lower blood pressure then?
Right, there are different classes of medications. You have what's called your beta blockers, and they can slow your heart down a little bit, which would help to bring the blood pressure down. Then you have your diuretics, would help you lose more fluid when you go to the restroom, which would bring the blood pressure down as well. And then you have your angiotensin receptor blockers, which causes vasodilation, which can help to bring the blood pressure down. And some people will respond to maybe one of these medications or a combination of two or three, but at the end, it's so important that your blood pressure is regulated.
Okay, so we talked about this a little bit off camera, but talk to me about why it is so important when patients come in for their blood pressure check. You got to take your medication before you come in to see you.
Definitely. The problem that we're coming across so often over the last 20 years that I've been had the privilege of practicing medicine is we'll have an individual come in and they haven't been to the doctor in 4 or 5 years and they're 40 and up. And everything is great. No diabetes, cholesterol is perfect, but the blood pressure might be a little bit elevated. Or if it's very elevated, we might go ahead and start them on medication that day. But if it's a little bit, we might bring them back in a couple of weeks. And if the blood pressure is still elevated, then we might put them on meds. But there's another visit, maybe 1 or 2 weeks later after a person is started on blood pressure medicine, where we want to check the blood pressure with the blood pressure medicine in their system. And in a lot of cases, people will say, well, I didn't take the medicine today. And I explain to them, take the medicine, especially the morning of your appointment. And that way, when we check the blood pressure, we'll know if it works or not. That way, we'll know if we need to go up or possibly go down if it's too strong. And this message is so important, and I hope everybody that hears it will share it with anybody that they love, including themselves. Take your medicine the day of your appointment, and if you can, take the bottle with you so there'll be no confusion.
All right, good tips there. Also, maintain your follow-up visits as well.
That is
very
correct.
critical.
Thank you.
All right, Gracie, switching it over to you.
All right, Tal.